I've been tasked to talk about indications for reverse and massive irreparable rotator cuff tears. I do have some relevant disclosures, as I have been the designer of several reverse arthroplasties over the years. So the treatment of rotator cuff tears is one of the most common things we will encounter as orthopedic surgeons and certainly as shoulder specialists. For those that rotator cuff repair is indicated either by arthroscopic or open methods, we can improve pain and function quite predictably. Most rotator cuff tears, thankfully, are repairable, and today most of these can be repaired by arthroscopic methods. And as far as irreparable tears, which comprise a smaller percentage of rotator cuff tears, most are massive, but massive does not always mean that they're going to be irreparable. A lot of that has to do with tissue quality, and that can be predicted based on preoperative imaging in most cases. So after a thorough examination, I believe that we can get good information for what we're going to do from plain radiographs. And one of the things we want to focus on is static subluxation. We know that when we have proximal migration and a acromion-humeral distance of 6 millimeters or less, it's pathognomonic for a supraspinatus, infraspinatus tear, or if repairable, there is a very high risk of re-tear and failure of primary surgery. The axillary lateral gives us some information about subscapularis. Here we see a well-centered glenohumeral joint, but when we see static anterior subluxation, as in this left shoulder here, that's suggestive of subscapularis insufficiency. More importantly, though, the MRI can give us information about tissue quality. We've heard this over and over. This is Bruno Fuchs's work where he validated MRI to Goutalier's work with CT arthrograms. And so here we see advanced fatty infiltration of the supraspinatus and infraspinatus, and we can glean that these are likely not going to be repairable. And if we are to achieve something surgically, pain relief will be more predictable than functional improvement. So it's all about setting patient expectations, as it is with everything that we do. And there we see a non-repairable tear.